Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment. The goal here right now is to show you guys another way, a smarter way to start looking for the right places to go after, meaning you're going after the people that really have home health patients. So imagine, would you guys, I'm sure you guys right now are excited because you guys are wanting to see, okay, how do I know which physician is the best physician? Not just, what their specialty is, but really their name in a specific city, in a specific county, in a specific state. How do I find out which one are the best people to go after? And I'm going to show that to you guys. I'm going to show that to you guys through how to find out which is the best physician to go after. I'm going to share with you guys, which best nursing home to go after. Because the truth is this, you want to go after nursing homes, right? I know you guys want to go after the nursing homes that do have patients. There are nursing homes that don't have a lot of Medicare patients, but would it be amazing if you guys can actually know which nursing home has the most amount of home health, patients that are being referred to? Now, first of all, guys, whenever you go to a physician, whenever you go to a nursing home or a hospital, they are already working with their preferred agencies, right? But at any given point, the current agencies they're working with were not the agencies they were working with last year, 2 years, 3 years ago. So the goal here is to get data and use the data to your advantage. And this is what makes larger agencies more successful because they used to have research people that can help them figure out which one goes well. Well, now with the software right here that we're going to use in front of you guys, it's going to even the playing field for you as a smaller agency. Now, there are several softwares out there that has these information. But this particular software that I'm sharing with you guys, what's great about them is they have the most recent quarter of information that's coming from Medicare. Whereas the other software companies are just using the data they got from last year. Okay, so having the most recent data is the most important thing for you guys to be able to have because it's the most current. It helps you analyze things better. So, previous, ways of looking for, nursing homes in your area, you're going to look at your Medicare.gov information, right? So if I go in the Dallas area, for example, where there's about 103 nursing homes or skilled nursing facilities within 25 miles of the Dallas area. And of course, let's look at your competition. In the Dallas area, for example, you're going to be competing against 624 home health agencies. So let's go ahead and now go into the software. So what we're going to do here is we're just going to start off with physicians. Physicians are really great places to be able to market your home health agency. And what's great about that is what we're going to do is we're going to become more specific. When I work with a lot of the home health agencies that we consult for, that we help them grow, we ask them like, hey, which physicians you want to target? And most of the time we're going to hear, well, we just want to go after, family practitioners, ortho physicians, so and so. And it's good to be able to have an idea of what the specialties that utilizes home health agencies or home health services better. But you want to become more specific. So we're going to take it to the next level where we can actually go into the physician's information and find out which physicians have the most patients. So I'm going to go ahead and clear this. So this particular software right now, the one that I have is based for an agency in Texas right now. So the information in this software that I'm going to share with you guys is pretty much everything within Texas. Now, if you're in California and you start using this software, they'll set you up to be able to get the information in California. Okay, so wherever you are. But right now, let's just pretend we're an agency working in the Dallas area, okay? So in the whole state of Texas, there's approximately about 66,565 physicians, okay, that are practicing within that state. But what we want to do is we want to become more specific. So we're going to go by location and we're going to go after physicians in a certain city. So I'm going to go ahead and put Dallas down. Choose Dallas. And so what's going to end up happening is it's going to bring down the information. We're niching down, right? It went from 66,000 with the whole state of Texas to now in Dallas, there are about 9,090 places. Now, using that information, right, is also is important. But when we look at the specialty, there's a mixed specialty, radiology, physical medicine, internal medicine, obstetrics, and all those things. We're not going to go against these other places that's not going to refer to us, right? Because that's not what we want to do. So we now are going to narrow it down even further and choose a particular specialty. Let's just go ahead and use internal medicine. It's just where there is definitely a lot of physicians that are referring to home health services. So now we're down to the specialties, okay? And so when we look at the information that we have, we now popped up the information that we need. And as you guys can see here, now we went from 66,000 to 9,000, and now we're down to 1,435 physicians. But listen, guys, you don't want to just target a thousand places, right? What we teach in our 10xpatientreferrals.com training is that you need to be able to have a sales process, and if you don't have a sales process, it's what's going to cause you guys to have problems. You can't just hire a marketer and say, just because they have a list of people that they can go to, and you say, go out there and get me patients. You need to be knowing and have a whole process, policy and procedure in place on your marketing strategies within your company. So what we teach is we teach the different steps needed in a sales process, and you cannot miss a step, because if you try to take the easy route and try to skip a few steps, a few techniques, and that's where you're going to have some failures happening. And so now we know we want to target internal medicine, we want to target certain physicians, and now we're going to be more deep into this thing, right? So as you guys can see here, right? As you can see here at this very moment, we have Dr. Tao, for example. So Dr. Tao is an internal medicine physician, and what we can see with information with Dr. Tao is that he has, or she has, I'm not too sure yet, 1,374 patients within the past 4 quarters, the past year, right, that are Medicare patients. But you're probably thinking like, wow, that's amazing. That's a lot of patients. But the truth is, we need to go on to the next part, because just because you're a Medicare patient, that doesn't mean that they need home health services, right? So the next column here shows that Dr. Tao, out of his 1,374 Medicare patients, 819 of them utilized home care services within the past 4 quarters. So that is a high amount of patients, which is great. But we need to compare that to the next column, which is the followed patients, right? And so this allows us to determine, is this doctor a high utilization physician or low utilization? So if we see the followed patients, we now know that out of the 819 patients of his or her that got home health services within the past 4 quarters, actually 716 of them are patients that he followed up with. Now that right there is a number that I can definitely work with. So just imagine that, right? 700 patients of his are patients that he followed through. So that means this is the physician that we really want to go after right away. And the reason for that is, well, that's 700 patients. So, we want to be able to dive deep into Dr. Tao right now and see some information about him. And so this is what we're going to do. If I click to Dr. Tao's, profile, now we're finding out more about this particular physician. And so we know that, his location is in Dallas County, Dallas, Texas. He's an internal medicine practice. Okay, we have his NPI number here. If I click here, for example, I'm sure we're going to be able to get more details in regards to his address, some phone number informations that we can actually, use later on. It just allows us to target him even more. But what we can do is we can start looking at Dr. Tao's information. I mean, isn't this amazing that now I can really start finding out about Dr. Tao? I know, for example, and Dr. Tao has a lot of patients in the Harris County area. I mean, this is by county right now. And the next one is in Ellis County. So that right there is really crazy to be able to know. We can even be more specific and go by zip code, but let's just stay by county. Let's keep on going down here for Dr. Tao. We now know also Dr. Tao's mix of patient diagnosis. Now, why is this important? Well, this is where you take advantage of your programs that you created, how you follow up and what type of education you can give, and you can share with the doctor why you guys are a match. So we know that, he has a lot of circulatory system patients, endocrine, musculoskeletal. That's his top 3, and top 5 is the respiratory and nervous system as well. So this is where you can show the doctor value by saying, hey, doctor, we have an endocrine program. We have our diabetes program. We have our, COPD program. We just have this cardiology program, and this is how we help our patients that have these type of diseases and how we can help them and why we're a good choice for you. Moving down for Dr. Chow, we can start looking at the different chronic conditions. We can even look at pretty much the average patient age of the people that he cares for. So if we look at this information right here, we know that 26% of his patients are under the age of 65. And then now we know, for example, that over the age of 65, 74% of his patients are over the age of 65. So this doctor is taking care of a lot of geriatric patients. He's a good target, or she's a good target. Now we can start looking to practice details, for example. So when we start looking at the practice details, we can now move down here, and guess what? Look at this. Facility affiliations, right? I now know that he works a lot with Ennis Regional Medical Center, Parkview Regional Hospital, Providence Hospital North Houston, El Campo Memorial Hospital, First Texas Hospital. So we now know that he's getting a lot of his patients or her patients from these particular facilities. Now, place of services, we can keep on going down as well. So a lot of his patients are office-based patients, right? So that's also great to know. Now, moving up to utilization, we can use that as well. But pretty much by looking at his information previously, we know that he has a high utilization type of a system set up, meaning that he really is taking care of his patients through and through from the office all the way to home, because he's making sure that they're getting home health services. Now, when we go to destinations, for example, this is where he is referring patients to. So if we look at home health destinations for Dr. Tao, we know that the top agency he refers his patients to is TheraCare Home Health. Now, what's alarming to me is just by seeing here is a bunch of red flags automatically, which I know that if I use the proper presentation to Dr. Tao, that I can potentially get him or her to try to use my company. The reason why is his top agency he's referring to has a really bad readmission rate. So within, the percentage right here, readmission rates within 30 days of admission to a home health, this agency right here is sending 16% of his patients back to the hospital within 30 days, and 37% of the patients that he refers to them are going back to the hospital within the 90-day period. So this is important because for hospitals, they don't want these type of, home health agencies to work with. So, I mean, just look, if we look here, within 30 days, 16.64%, that's 2.65% higher than the county average, 5.5% higher than the state average. If we look at here, plus 30 days, it's pretty much 10% higher than the county average and about 9% higher than the state average. So you don't want to be in the red flag as an agency. So what I can do is I can get the information. I mean, isn't this amazing, these information? I mean, I'm a data person. I love data, and some people, you may not be a data person, but or share the joy that I'm seeing right here. But this is a gold mine for me. This type of information, is something I wish I had, 10 years ago, 12 years ago when I started marketing. And back then, it was really boots in the ground, going into facilities and going blind and making sure I asked the right questions. With this one, I already have information before I even walk in, which is so valuable to have. Okay, so we now know that the top agencies he's referring to, right? Remember, this doctor is referring 716 patients to home health where he or she is following them through. So right there, we know the destinations that's happening. What we can then do is, through this software, is now create a presentation to share with the doctor later on to compare to him and say, hey doc, just to let you know, these are the information that we want to share with you guys. So we can actually go ahead and show this to the physician. So let me go ahead and back up here a little bit. All right, so I'm going to click here. Select comparisons. What I'm going to do here is select comparisons. I'm going to choose the top 5 destinations the physician's sending his patients for home health. So once we have that, we have these things right here. They've been applied. Apply that. So remember TheraCare that we showed you the first one. If we start scrolling down here, for example, we now can share with the physician these charts. As you can see here, hey doctor, let me share with you guys about the current home health agencies you're referring to. And so all this information can be used. Now, we're just going through this software to show you guys this. I mean, we can literally sit down with you guys and detail everything and teach you everything about the software. I mean, when you start using these softwares, there's a whole training program that ends up happening to train you really how to use it. But I just want to be able to brush through it with you guys, the information. I mean, imagine if I go to a physician, hey doctor, are you aware that, TheraCare is unfortunately, 16% of your patients are being sent back to the hospital within that first 30 days that they admit them from you. Are you aware of that? And most of the time the physicians are not even aware of that because they're just so busy taking care of the patients in the office that they don't really follow through with that, right? They don't know the numbers. And so by you being able to show the numbers, that's going to be able to help you. And that allows you to be able to keep on coming back to the physician and giving them information. And so, like I said, a lot of physicians are not even aware of these things. And so what you can do is these things right here, the graphs, either pie or chart graphs, you can then export this into a PDF, okay? And what you can do then is you can then show that to the physicians, like physically show them. What I love doing is when I do a presentation to a physician is I bring in my tablet, my iPad, and do the show and tell right there. It just has the better look. But at the very same time as I always make sure I print it out as well so that the physician sees it in hand and they can keep it. Now, if I move out, I don't know if you guys are familiar with what they call CPOs or care plan oversights. A lot of agencies, hear from consultants or hear from people that this is something that you should use to be able to get more patients, because if you can tell the physician about CPOs or care plan oversights, then they're going to want to refer to you. But there's a strategy in using the CPOs. You can't just give them a piece of sheet of paper that shows them the information of the 3 different G codes. If you're not familiar with that, of what a CPO or care plan oversight is, that's perfectly fine. We go through that in our whole training at 10xpatientreferrals.com. But let me share with you guys how I use the data that I have to the physician and how I can, kind of ethically get the physician to want to see me, okay? So let's go out of Dr. Tao a little bit here. So remember when we were looking at Dr. Tao, we know that Dr. Tao has 716 patients, right? So I don't want to do the whole full math thing, but let's say, for example, if a physician signs the form or the telephone order for a patient to be referred to home health, he actually can get paid for that. That's called care plan oversight, taking care of the patient. And so they can actually bill that through the G codes. There's 3 different G codes that can be used. So let's say the physician can bill $100. We'll just make it an easy calculation. $100 for every care plan oversight that he does. So if this physician just does that one signature, just a basic care plan when a patient gets admitted, and he's seeing 716 patients a year. If you multiply 716 times 100, that right there is $70,000. Now, my question is, I don't know how good the biller is for this physician. I don't know. And so, with that said, from what I've seen, a lot of physicians are losing money, especially if if they own their own practice or a private practice. So what I'm going to tell the doctor is that, hey, doctor, just let you know, if working with a lot of physicians, we typically see that physicians are losing, right? Are losing between 15 to 70,000 with the type of patients you are taking care of. So because you took care of 716 home health patients last year, there's a potential that you're losing between $15,000 to $70,000 just in not accurate billing. Would you like me to show this with you? And so I cannot pay a physician for referrals, right? That's illegal. But I can surely show him how to make sure he makes his money. And so when I say that to a physician, lose up to 70,000 or even more, it's going to spark their interest really fast, and they're going to want to meet with me, whether they're using me right away. But how do I justify them to then transfer over to me? And I say, doctor, just let you know, the physicians that we work with, every month we actually will print out some information for them so that they make sure that their biller is billing it correctly. So we're just giving them information that's right here, and that's what's amazing about here, is about using data for that. And now the physician's like, oh wow, well, I'm going to want to work with you because that The other home health agency, number one, TheraCare, is really bad with their care because my patients aren't being readmitted to the hospital. That makes me look bad. And then he's gonna be like, and they're not giving me information about, which patients I can make sure I bill. That's bad as well. And so right there, it increases your value as a potential source to provide services for, right? So right there alone, that's how you can differentiate yourself from the other agencies. And that right there is such an amazing thing. So this is how you guys use, the information that you guys have by using this particular software. Now, a lot of you guys are going to be asking like, hey, Michael, what's the software? There's several softwares out there. This particular one, we're going to share this information with you guys. Definitely. And I just want to be able to kind of go through this really fast because there's a lot of information I want to share. So we talked about Dr. Tao, and then if we go to, Dr. Rinkenberger, Berger or Berger, you guys tell me how to pronounce it, right? It's up to you guys. Now here's the fun part right here. So Dr. Rinkenberger right here sees 3,845, Medicare patients, okay? And then 615 of his patients ends up in home health services last year. But here's the thing that is a little bit disturbing to me is the part of followed up. So that means this doctor is actually not following up with his patients, meaning he's not the one that's, he's referring it to other people to handle that. Now, this is what they call low utilization, right? When I'm marketing first if I go into a territory and I work with a company, I'm going to go with a high utilization right away. The reason for that is, these people with low utilization services are still good targets, but then there's that actually additional training you need to do, additional education for them to do in order to be able to say, hey, maybe you should start seeing your patients because you're losing this much number as well. Because remember, we talked about Dr. Tao, he could potentially lose. We know right now because Dr. Rinkenberger is not following up with his patients, he's losing a minimum of $60,000 a year because he's not following through with his patients. There's nothing wrong with that. That's just how his practice runs, but maybe help him make sense that he's losing some money if he just follows through with the patients. But like I said, the fastest way to go in marketing is to go straight forward to the ones who are high utilization right away. And to create a sales process, a sales target, you need to be able to, choose your top 150 targets and go after them the right way. Know how to be able to do your presentation, how to do your follow-ups, how to close the deals. All those all those steps in the sales process is such an important thing. So right there alone, I share with you guys how to find the right physician, okay? The right physician. The next thing we're gonna do now is look into nursing homes, okay? So I'm gonna go ahead and back to the whole Explorer thing. And remember, we're targeting Dallas. So I'm gonna clear my filters right here at this very moment. Let's just do that. And I'm gonna go right now into facilities, okay? So now when we go into facilities, we're gonna look into nursing homes. So let's go ahead and if I go to the facility type, for example, actually this is already chosen. So let's go here. Let me just do this first. So within the facilities, so you guys can see me do it from start to finish. I think that's more important to do. So I'm going to clear my my filters for now. And so by me clearing my filters, I'm going to choose a facility type. We're just going to go with the skilled nursing facilities. Okay, so this is being able to know which skilled nursing facilities actually have patients to give, okay? So if I'm gonna do skilled nursing facilities, I'm gonna choose that at this very moment. And then remember, we're not handling the whole state of Texas, we're handling just the Dallas area at this very moment. But in the whole state of Texas, if I look into this information, I know that there is over 2,500 skilled nursing facilities or SNF units that we can go after. But once again, we're just in what? Dallas. So let's go ahead and look into Dallas. Enter Dallas right now. Click that. And now it's going to niche it down even further. So by niching it down further, I know that I have a potential target of 161 skilled nursing facilities within the Dallas area, okay? And so it's the same exact thing that we want to do here. Let's go ahead and look at information. By looking at information, We now also can do the same thing like we did with the physicians. We can find out how many patients they have. So Medicare patients, Presbyterian Village North took care of 597 Medicare patients, but over here, only 251 of them that actually needed home health, that got referred to home health, okay, within 30 days upon discharge. So what this means is either they referred to them to home health services, or maybe when they got discharged, they were admitted to home health. So that means 251. Now, that is such good information. Why is it good information? It's because by knowing this, I know that they have 251 patients. So just imagine, that means they have an average of 20 discharges every month. That's crazy, right? That is so crazy, because now, if we can get into this, Presbyterian Village North, that's 20 potential referrals a month, right? If we become the primary choice for them. So let's look into Presbyterian Village North. They have 251, as you see here. Villages Lake Highlands is another one. So just imagine if you just target the first 20, right? Now this is just where we're prospecting phase. We're trying to find out more about them. So I want to be able to go into Presbyterian Village North. When I go into them, once again, just basic information. And once again, these are things that you can actually use with them. When you're doing your presentation, when you're going in front of the social worker, the discharge planner, it's such an important thing. Now let's just move on to their destinations, like where they're going to. But before that, as you see here, they have a 14% readmission rate, okay? Their top destination is Encompass Home Health, but let's go even further with destinations. So now by me going to destinations, we're going to figure out which home health that they're actually referring to. Now, by looking at this, okay, we're seeing that their top ones are these particular 4 agencies, okay? These are the 4 agencies that they're actually referring to. And the reason for that is, when we walk in, then they say something like, for example, we're already working with another agency. Once again, most people, when they hear an objection, they're like, well, okay, here's my brochure, here's my card, give me a call if you need our help. I really want to help you have quality services. That's not what you're going to do. I'm going to answer and say, hey, listen, the moment I walk in that door, I already knew you're already working with other agencies. That just happens every time that nobody knows us yet. Like for example, I know for a fact that, you guys refer to Encompass, DFW, Home Care, and also Arlowski. And sometimes when I have that information, they get shocked. They're like, how do you know that? And so, my goal is never, when I first walk in, is to try to convince them to give a referral to me. The first time I walk into a facility, I always try to find out more about them and how I can service them. So by me having more information allows me to, kind of shock and awe them a little bit. And just say, hey, do you have 30 seconds of your time? I just want to be able to share some information with you about the agencies you're working with right now and to find out more about you. So I'm able to really figure out what's going on with these places, right? So right here alone, I know that that's who they're referring to. Allows me to then also create, a presentation to them so that I can do a comparison for them. Going out to the other place, Villages of Lake Highlands, for example, I'm going to go into them. And then I'm also then going to show them destinations. And so when I go into destinations right now, once again, Encompass shows up, but guess what? They are utilizing Beyond Faith Home Care more than Encompass, okay? So now you're seeing a different mix. What scares me the most is when I go into these information of destination is that if they're only using one home health service, right? So typically if I'm seeing that they're only using one, then I know right there and then I'm not even going to try to target them. Those are things I'm going to look at. Is if they're using only one, whether you're a physician, you're only using one agency that you're referring to, or you're a nursing home and you're only using one, that means it's going to be a little bit harder for me to kind of convince you to change. So I want to go into facilities that have a good different mixture of at least more than 5 agencies they're using. Because, just imagine this, right? You don't have to be number one. You don't have to be Beyond Faith Home Care and take all 33. But imagine if you can be Brookdale instead and you get 13, right? You get those 13 referrals. So, it's about power by numbers. It's like if you can get a good 30 places that's referring you, 3 to 5 a month, 30 places times 5, that's 150 referrals each month for you. You see what I'm trying to go at? You can't just expect to have just one facility that gives you it all. And the truth is, one thing I teach a lot of the the companies that I consult for is that never ever rely on one facility. If one facility is referring more than 30% of your patients, you have a problem, my friend. And the reason for that is if you lose that referral source, it's going to kill your agency. It just will. So you want a bunch of different referral sources. I mean, isn't this great that you can now find out, who the nursing home is referring to? Before you would walk in, you number one, you didn't know how many patients they actually have. Number two, you don't know who your competition is. I mean, this is part of prospecting, is knowing your competition. How can I use an advantage of knowing my competition? Well, the first things first that I can use is by me getting this information, right? I can then go into each one of these home health agencies and figure out what are they doing. Is their website designed right? What are their marketing collateral? I might even call them and do a cold call and pretend I'm a doctor and ask what type of insurances they accept. There's just a bunch of different things that you can do, and so that right there is taking advantage and using the information. So now, I know which nursing homes to target. Earlier on, we talked about the physicians. Now we know which physicians we need to target. So, just imagine the information that you guys have in this software right now. Now, let's go ahead and go out. Like we talked about what? Nursing homes and the physicians. Now, let's go ahead and change things up a little bit and clear it again. And now, let's say, for example, we want to go after hospitals. Now, if you're in your marketing stage and you're in a brand new marketing target or a marketing blitz, for example, I always tell a lot of facilities, stop trying to get into hospitals. You just want to be able to grow your base first. And so hospitals are just a different monster. It's a lot harder. And the reason there's a lot of red tape, you have to deal with a lot of people. But that doesn't mean that it's not possible. Of course it's possible. I love targeting hospitals. But, when you're doing a marketing blitz, I seriously would say go after as much physicians and as much of nursing homes as possible, because that right there is a lot easier, or what they call lower hanging fruits. Okay. But I just want to be able to show you guys why it's also important to deal with hospitals. So if we're targeting hospitals, for example, let's just go ahead and just say all the hospitals. That hits us right there. The next thing is we want to target a certain location. And so when we're targeting location, once again, we're going to hit Dallas. Okay. So we're going to put in Dallas. And once we choose that, it narrows things down even further. Now we know which hospitals we want to kind of target in the area. Now we're going after 103 hospital systems at this very moment. And now we move forward to the same information that's important to us. Number one is Medicare patients. This hospital, UT Southwest Universal, has worked with 37,000 Medicare patients. But if we start seeing here, all patients entering home health within 30 days of DC is 3,143. That right there is a lot of patients. A lot. 3,000 patients. Imagine if you divide that by 12 months. That is a lot of patients, everyone. And that right there is being able to know what we actually need to do. I mean, so if I go in further into UT Southwestern Universal Hospital, now I'm getting the information that I want. I can go directly into destinations. Now I can start looking at, who they're referring their patients to. And what's amazing when you're looking at the hospitals, it's not just being sent directly to home health, but now you have other information you can get. So what happens is, home health, we are now going to find out which home health they're referring to. Now, right here, we found out, look, UT has their own home health agency, okay? They have their own home health agency. And so one of the biggest things that a lot of people will say, well, Michael, that hospital refers all their patients to themselves. I hear this so much time. I don't want to go after the hospital because they have their own home health agency. Well, yeah, but they cannot just give all their patients out to their own home health agency. They have to spread it out. They need to spread the love, right? So, when I hear that, I can show a home health agency this, and I can say, look, don't believe in your own objections. That's your objections. So right here, with all the patients that they have, right, the 3,000 the patients that they were referring to, the 3,000 patients that they were referring to home health, only 300 of them ended up in their own home health agency. The rest of them has been divided into multiple agencies. I mean, look, they have multiple agencies they refer to. So, like, for example, Encompass is a big home health agency, and they're only getting 18 from this hospital. So there's other agencies, or here's yeah, so multiple encompasses. So that's the thing, guys. You know, can you be number two? Can you be number three? Heck, I don't mind being in a hospital system and right here and getting 20 from them. That's still a lot, or 26. That means I'm getting what? 2 patients every month from them. Every patient counts for your home health agency, and this is such an important information to be able to share with you guys. Just give me a second. Let me take a quick sip. Kind of just starting to get parched here. All right, so right there alone, we know that they don't just rely on just one agency. So when you start, creating your programs and start creating your presentation to them, you can compare and you can say, hey, listen, this place right here is causing problems for you. So that right there is the power of data. And so I hope that this information help you guys out. And so this is a great way to really find out who you want to target. So just imagine, right? So what we always teach people in our 10xpatientreferrals.com training on how to increase your referrals, increase your profits for your home health agency, is that what we want to do is we want to create a target zone. So I'm going to target, let's say, for example, 150 places, right? So I'm going to target, maybe 100 physicians of high utilizations, and then I'm going to target maybe 30 nursing homes, and then I'm going to target maybe 20 hospitals. It's up to you how you guys want to do your mix, and then that's who I market fully to, and try to convert maybe 30% of them, and then start a brand new marketing blitz again. And in every step, we're going to show that to you guys at our 10x training. So that's how to find out. Going after physicians, going after the nursing homes, going after the hospitals. Okay, these are the important information that you guys need to have. And so, so I'm going to now leave the computer and we're going to talk a little bit more about your marketing specialties and what you guys need to do. All right, let's go ahead and get started and move on and keep on giving you guys so much amazing information to be able to, have a successful marketing strategy for your home health, your home care, or your hospice agency. Brought to you by our partners at homecareansweringservice.com and medicationreminderprogram.com. So medicationreminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, homecareansweringservice.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have homecareansweringservice.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.